Hello all, today we are going to look together the price of health literacy. I'm Joyce here. Please welcome to this session. As I said in this presentation, let's look together the outlines of today. First of all, we are going to define what is health literacy and what are the effects of health literacy. We are going to look together the skills needed to ensure health literacy, and we are going to look together the health literacy in culture context. We are going to follow by the importance of health literacy, the impacts of health literacy on patients' nutrition, medicine use, and disease prevention. And we're going to look together who is responsible for improvement of health literacy. Finally, the key takeaways of the presentation and the references. Uh, First of all, let's look together what is the definition of health literacy. According to the Internet Archive, health literacy means the degree at which individuals have the capacity to obtain, process, and have to understand the basic information and services needed to make the appropriate health decision. In other words, it is a degree in which individuals have the ability to find, understand, and use information and services related to health and making the right decisions for themselves. Let's look together the skills needed for health literacy. For an individual to understand and interpret health message and making the right decision have to have the following skills. It is true that health literacy includes numerous skills. There can be some skills needed in health, like calculations for medication, like the kind and level of dose of sugar levels a person has to take, and others that help patients to understand the nutrition labels required, and all those requires math skills. But mainly, some skills that we all need are like reading skills, listening skills, decision making skills. We also need analytical skills to analyze what we are given or what we want, and communication skills in case we do not understand or we have any problem with the healthcare professionals. And last but not the least, the interpretation test skills. Sometimes we're given tests, but if you do not know how to interpret them, sometimes it can be a problem. So these are the skills needed for health literacy in health for an individual. Let's look together health literacy in cultural context. Culture affects how people communicate, understand, and also respond to health information. The way people behave and what they believe in highly affects health in general. So it is to mean that culture, linguistic, the competence of health professionals can contribute to health literacy. Effective communication should be the key to avoid any mistake or misunderstanding on both sides. That is to mean that if patients and a healthcare manager, according to NIH, they have to make sure they understand each other. If you're, maybe let's take an example of a Rwandan healthcare professional working in Uganda has to make sure they know the language and they believe and they have culture beliefs so as to not be misunderstood or to make sure that the patients understand them. This can help both sides, patients and caregiver, to interpret what is told and give clear information to the patients as well as being able to interpret their needs. So, which means that, like I've been saying, culture plays an important role in health literacy. The way people communicate, the way people believe greatly affect health literacy, and it helps to understand patients' beliefs and customs as well. Understanding them can help in health literacy. So one have to understand their communication styles and understand their response to health information on both sides, to the health caregiver and also the patients, for them to understand well. There's some importance of health literacy. Let's look together some. So there is 12% out of adults that have proficient health literacy according to the Internet Archive, meaning that 9 adult patients may lack knowledge and skills of managing their medication and health in general. So which means that health literacy helps patients to prevent diseases, making right decisions, managing their medication, taking the right dose, and so on. Also, health literacy helps patients to take control of their well-being through making right decisions, like I've been saying. When you know exactly what you want, or you know exactly what the doctors want, makes you make the right decision. And health literacy helps in easily accessing to care and prevention of health conditions through effective communication. Uh, According to Internet Archive, just once said that the reality is that everyone needs the access to health literacy skills so as to successfully find and access care and prevent certain health decisions effectively. So this can help effective management of those incidences, and it can lead to effective communication to their needs and understand the choice they have to make during health. So a lack of health literacy can have consequences on both patients' personal health and also a nation at all. So it is very important to have literacy, health literacy as a whole. Let's look together the impacts of health literacy on patients' nutrition, medicine use, and disease prevention. It is true that health literacy might be both positive and negative, but guiding people through the process and giving them strategies to find and understand accurate food nutrition information allows them to have a new sense of empowerment and help them fight diseases. So that is to mean that health literacy is important because it helps patients to communicate effectively in case there is a problem. So being health illiterate is a stronger predictor of health than socioeconomic status and education, or even ethnic or even race. So it is very important to be health illiterate because it determines exactly how people are living and how they manage their living condition in terms of health. So being health literacy helps patients to have the right to information towards diseases and the right at the right time in the right place, and even having to be able to identify what to prevent and how to live well during health conditions, meaning that health literacy goes beyond just health, like educating people about health and guiding them can help them live and on the right track, and even expand their life expectancy in the way people use food labels, the way people manage the quality and the quantity of diet also can help, which is different from a person who's illiterate. So understanding food labels and seeking trusting nutrition sources, these all affect dietary quality as a whole. Let's look together who is responsible for improvement of health literacy. First of all, people have to make sure they understand exactly what is going on. So, healthcare professionals, as well as health, as well as patients, have to take a big role in improving health literacy. Meaning that health literacy can be done responsibly through the following. According to Health People 2020, training health, it's important to train both adults and young people at the same time to equip them with skills, but mostly should be on adults because they're the ones who do not go with the updates or trending on this earth. So making health professionals working hand in hand with patients is the first key needed to reduce disparities in health status. In this presentation, there are some key takeaways we can look at. First of all, in this presentation, we have learned about what is health literacy, which is the degree in which individuals have the capacity to obtain, process, and have to understand the basic information and services so as to make appropriate decisions. Secondly, health literacy is important because it helps in performing disease management, controlling what we eat, how we manage test interpretation, and even others. It is important to equip health education in mostly adult patients because that's where uh, much work is needed, because they're the ones that are not yet equipped or are not yet updated, which is different from the young generation. Also, we have looked together the health skills that help patients to maybe accurate their health concerns and describe their symptom accurately. Those are reading, listening, analytical skills, and decision making skills. Winding up, these are references for more information about health literacy. Thank you.